And the last piece, since you're still with me for this Communicating with Patients with Mental Illness series, that I want to key into is the incorporation of what we call trauma-informed care or a trauma-informed approach. And this is something that is supported through SAMHSA and the CDC. And there's even specific trainings that can be done to help guide healthcare providers to improve their provision of trauma-informed care. What does it even mean? Well, it's kind of what it sounds like. So it's providing care in a holistic manner that takes into consideration the context with which someone resides. This incorporates things like adverse childhood experiences, previous traumas, the recognition and celebration of autonomy and advocacy for your own care. So this allows for people to feel more engaged and validated within their care. And essentially the goals here, the goals and principles include establishing a sense of safety. So helping people feel like their care is done in a safe space. Establishing trustworthiness and transparency. So being authentic, being transparent, being, factual with your patient. Offering peer support. So removing some of that social isolation and lack of social support. Creating a space of collaboration and mutuality, which is a bit of a mouthful, mutuality, which essentially means encouraging things like shared decision making, right? Giving them choices, giving them space to consider some of those options and having some power in determining their own treatment and their own care. And that's where number 5 comes in, empowerment, voice, and choice. So giving those pieces, giving people the ability to take charge of their own health care, their own mental health care, more so than before, where it was much more paternalistic healthcare itself, where, the physician or whomever would kind of just tell you what to do and you would do it. This is more that individualistic culture that allows for more expression of concerns and, discussion of choices. And then taking into consideration cultural, historical, and gender issues. So recognizing some of those disparities, recognizing that religious or cultural influences may alter your experience in the healthcare system or alter your decision-making process or priorities, and validating and recognizing those things to help provide a culturally and trauma-informed approach. If someone has an eating disorder, for example, if you don't need to get a weight on them, don't get a weight on them, right? If it is not necessary for their care and this is potentially going to harm them by forcing them onto a scale, don't do it, right? Some of it feels like common sense, but we often in healthcare are kind of taught this algorithm that you're supposed to follow X, Y, Z, and if you skip X, then you did it wrong. But that's not always the case. Sometimes we're trying to really edge more towards harm reduction or edging more towards, meeting someone where they're at so that they can make over a long period of time better strides, right? Maybe they don't feel comfortable wearing a hospital gown. Yeah, it's going to be easier to do that evaluation, but they're going to feel vulnerable. They're not going to feel safe. They're not going to feel supported. They're going to feel like that choice was taken away from them. So if there are spaces where we can do those types of things, then that's really important. If we can offer an approach that allows for them to feel that way, then we should be doing that whenever possible. So how does this all wrap up? We have to cultivate a culturally sensitive, trauma-informed way of communicating. And this is in every space of healthcare, whether you're counseling a patient on their medications, whether you are engaged in ambulatory care clinic, whether you're inpatient, all of these things culminate into trying to communicate things in a way that is sensitive to the individual who's experiencing mental health challenges. And even beyond that, right? We want to be kind to people. We want to know that they are just humans. They're individuals, and none of us are perfect. We might be experiencing things that make communication more difficult, and being respectful of that. So a couple different things that you can really do to sum up all of this is offer questions, offer assessments that are taking all of these pieces into consideration, but not overtly always. It can be a way to assess their decisions and their desires. So there's 3 pieces here that I suggest. So assessing their context and their understanding. So what is your understanding of what's happening to you, right? If someone is in the emergency department for, depression with a recent suicide attempt, what happened? What do you, from your perspective, from your understanding, what's happening? What's going on right now? It's important to understand what's most worrisome or problematic to the person. It is also important in a lot of cases to understand what their family or relatives, loved ones think of what's going on, because that can put it into context of what their cultural experience is, or what their stigma is, or their barriers. Assessing and using outside resources. So who do you turn to for support? What kinds of supports already exist for you? Who do you want involved in your care? Who do you feel should be involved in your care? Are you open to expanding that? Are you open to additional information? Being respectful of their practices and their needs. So how do you prefer to make your decisions? So some people, I'm talking all about this autonomy and shared decision-making and all these things. They may be more of a collectivist. Older generations can be a bit more like this too, in certain cultural backgrounds, where they want to tell you what's going on and have you make the decisions for them, and they will follow the decisions that are made. They want to listen to your counseling, or listen to your vaccine recommendations, or listen to your recommendations for psychotherapy or whatever, and we'll take that as, for lack of a better term, gospel, I guess you could say, right? So it's important to understand that if they want to do a lot of their own research and be a huge, advocate and partner in their care, versus being more apt to want to be told what to do, essentially, right? Or is there anyone else we could talk to? I'm going to scooch down about this, about your care. So some cultures, some individuals, some families may really prefer having that family group mentality or family group approach in treatment, if that's what that patient wants for their care. Knowing that, respecting it, and trying to do that whenever possible can be really good in establishing a really positive healthcare experience. So when we wrap this up, I want you to think that there are so many factors that can influence how we effectively communicate with individuals who experience mental illness. So thinking about their background, thinking about their symptom burden, using inclusive wording, right? So speaking in a way that is not stigmatizing, considering their generation, their past trauma, being trauma informed, and practicing empathy, right? If we think about pharmacists, which this is focused on, especially say if you're a community pharmacist, I always like to say you're often the last stop on a really bad day for people. And sometimes people just are not having a good time. And not to say that you deserve to be spoken to meanly or spoken to poorly, but trying to keep that sense of empathy in your hearts whenever possible, while also recognizing your own limitations and your own safety and risk of experiencing things like secondary trauma. Understand your own limits. Using open-ended questions, practicing non-judgment, and trying to embark in communication in a way that is informed but individualized. You can improve the experience of your patients, improve your relationship with your patients, and ultimately be an excellent communicator for patients who are experiencing mental health conditions.